Bonjour à tous, je vais vous présenter.
Good afternoon. I'll be talking about the outbreak of dystonic syndrome we've observed last year in DRC. It started at the end of 2014 when a first suspected case of meningitis was recorded in Ariwara health zone. Very quickly afterwards, several other suspected cases were recorded in this region, as well as in two other neighboring health zones in Laibo and Adja. As you can see on this map, these three health zones are at the border with South Sudan and Uganda. The Ministry of Health requested the support of MSF to try and respond to this suspected outbreak of meningitis. When the MSF teams arrived on site, they immediately realized that the clinical signs symptoms observed in patients were not typical of a typical meningitis. There was, of course, neck stiffness, which was not connected with fever, but rather with other clinical signs and symptoms, hypersalivation, oculogyric crisis, macroglossia, as well as muscle contractures. Lab results have shown that what was observed in the field by the clinicians did not confirm the diagnosis, because out of the 80 cerebrospinal fluid samples analyzed, and more than 90% were clear, and out of the 71 pastorex which were analyzed, only 3 were meningitis positive. Quite quickly, the meningitis suspicion was ruled out, and they ended up with a series of questions. Experts were then consulted, and after several weeks or even months of discussions, this extrapyramidal syndrome, which was observed, was connected to the phase truncal dystonic syndrome, which is typical of a drug intoxication due to neuroleptic drugs. We've carried out our investigation in close cooperation with MSF Switzerland to try and describe this epidemic and try and understand what was happening. All in all, these 1,029 cases were recorded from December 2014 to August 2015. In the 3 health zones, there were 11 deaths, and patients were responding to the treatment, which was biperidone for the first-line treatment. It's an anticholinergic drug, which is often used to correct the effect of neuroleptic drugs when Parkinson's syndromes are observed. The second line was diazepam Valium for its anticonvulsive effect, and which was also well tolerated by patients. Urine samples were collected from 9 patients to try and identify the molecule that was to be found in this urine, and very specific studies have shown haloperidol in urine with rather high concentration levels. Haloperidol is a neuroleptic drug, and in fact, we wondered how those patients had access to haloperidol, and in fact, we collected some tablets that either been taken by the patients, or we bought them in the local pharmacies, and toxicology tests have shown the presence of haloperidol in a tablet which was supposed to be diazepam, and which in fact included 100% of haloperidol. So we've performed an analytical study to try and identify the risk factors which were related to the onset of this dystonic syndrome in the Adja health zone, because this is where the most cases were found, and we were wondering whether this alleged diazepam drug was the only culprit of this poisoning, or if there were other drugs involved, and we were wondering what was the healthcare pathway that had led to the onset of such syndromes. And we've performed single-center case control study. The cases were recruited in the MSF treatment center, which included all the dystonic patients. And for the controls, we had for each case 2 controls matched by age, sex, and village of residence. Each patient was interviewed to try and estimate the number of tablets they had taken 7 days prior to the interviews. And for all those cases, we collected urine samples. And for one subgroup of controls, we also performed urine samples collection. And whenever possible, when those patients had tablets with them, we collected the tablets which they said they had taken in the 7 days prior to our survey. 36 cases and 71 controls were included during the study, which went on for about a month. And you see the majority were under 15. Urine samples analysis has shown that it was haloperidol positive, showing that haloperidol was indeed the culprit. And for the subgroup, the 71 controls, we had 20 samples analyzed. 4 were haloperidol positive, even though those people didn't have any dystonic syndrome signs. Now, regarding the tablets that are taken, since it was difficult in this area to give a name to these drugs, we had drafted the questionnaire so that people would be able to describe the tablets according to the color, size, and shape. And those that were described as white big round or yellow small round were most often mentioned and correlated to this dystonic syndrome. And initially, it was not planned. We've also noticed that people often went for consultation in healthcare centers, and in agreement with the local MOH representatives, we've analyzed the prescriptions that had been given to these patients. This has allowed us to realize that the tablets which were described as white, big, and round were correlated to paracetamol prescriptions, and the tablets described as yellow, small, and round were correlated to the diazepam prescriptions. We collected drugs from our patients and from controls. The tablets they had taken in the 7 days prior to our survey. 15 types of paracetamol were collected and 6 types of diazepam tablets were collected. The toxicologic analysis had shown that the alleged diazepam tablet with the name AGOG, the yellow, small, and round tablet, contained 100% haloperidol. And we've also shown that patients who were going to the treatment center had the highest risk of dystonic syndrome because this is where this molecule was prescribed. So the study has confirmed that haloperidol was the cause of the epidemic, that what was sold as diazepam under the name Agog Pharma was the culprit. Agog Pharma is an Indian-based company with subsidiaries in Uganda. With a quick warning letter, the WHO informed and warned the authorities. So the DRC authorities have prohibited the prescription of diazepam in the area. It has helped to decrease the number of cases and put an end to the epidemic. The investigation is still underway to try and understand where these molecules came from. Thank you for your attention.
Many thanks, Florentina.